Good afternoon, fellow Namibians. Today we have received a total number of 1,054 results, and this came from NIP, UNAM, NAMDEB, and PathCare. Out of this, 138 samples tested positive for COVID-19. 71 are males and 67 are females. The youngest one is 2 months old, while the oldest is 78 years old. The cases are distributed as follows: Walvis Bay, 44, Swakopmund, 15, Usakos, 1, Windhoek, 64, Oshakati, 3, Keetmanshoop, 3, Mariental, Rehoboth, Onanjokwe, Okakarara, Okahanja, Ochiwarango, Oshikuku, and Okongo reported 1 each. Of the cases which have been reported from Swakopmund district, 3 are from around us. The case reported from Usakos is a 32-year-old male from Caribbean with no known to a confirmed case. He was tested as he presented with COVID-19 related symptoms. The 3 cases from Oshakati district are 1, a 40-year-old male from Okatana, and a driver of a fishing company who transports fish between Walvis Bay and other parts of the country. He was tested because he displayed symptoms consistent with COVID-19. The second one is a 38-year-old female from Okashanja and a contact to a confirmed case. She presented with COVID-related symptoms. The third one is a 41-year-old male from Wediva with no known contact to a confirmed cases. He presented with symptoms consistent with COVID-19, and that's why he was tested. The cases reported from Keetmanshoop, 1 is a 49-year-old male truck driver and a South African national who traveled from South Africa on the 6th of August 2020. He was tested on the same day, according to our protocol. The second one is a 41-year-old male truck driver and Zimbabwean national who resides in South Africa. He was tested on the 5th of August as he recently traveled from South Africa. And the other one is a 78-year-old male who was tested at NAMDEB laboratory. We are yet to get more details on this case. The cases from Mariental is that of a 30-year-old female with no known contact with confirmed cases. She was tested as part of active case search. And the case reported from Rehoboth is a 27-year-old male, a resident of Rehoboth, who works in Windhoek. He is a contact to a confirmed case. And also, for the fact that she presented with COVID-19 related symptoms, has been in the quarantine since the 8th of August. The case reported from Nanjoko is that a 42-year-old male from Onaina with no known contact to a confirmed case. He traveled from Windhoek on the 11th of July. He was tested because he presented with COVID-19 related symptoms. The case reported from Okakarara is that of a 25-year-old male from Okamatapati, a contact to a confirmed case. He was also tested because he displayed symptoms consistent with COVID-19. The case from Okahanja is a 32-year-old male who is a contact to a confirmed case. He was tested simply as a part of active case search. The Ochiwarango case is a 31-year-old male and a healthcare worker. He was quarantined and discharged after testing negative twice. But when he presented with symptoms consistent with COVID-19, he was again tested and the result came out positive. A case reported from Oshikuku is a 21-year-old male who illegally left Walvis Bay on the 6th of August, and the family reported him to the security cluster. He was then quarantined on the 7th of August and tested the same day. The case reported from Mokongo district is a 24-year-old male from Onangulo who lives in Congo with no known contact to a confirmed case. He was tested because he presented with COVID-19 related symptoms. 11 recoveries are recorded from Erongo and 2 from Omaheke. Other regions are yet to verify their data. Of the active cases, 7 cases are critically sick and 14 are in severe sick condition. It is also with sadness that I am reporting today 5 more deaths. 2 from Walvis Bay, 2 from Swakopmund, and 1 from Windhoek. Their details are as follows. I'll start with the Walvis Bay cases. 1 is a 67-year-old female who presented to a private health facility on the 23rd of July with symptoms consistent with COVID-19. Patient was admitted on the day of presentation in a severe condition. She is known to have multiple comorbidities and died on the 12th of August. The second one from Walvis Bay is an 87-year-old male who presented to a local health facility with symptoms which are consistent with COVID-19. This patient is also known to have multiple comorbidities. The patient was tested on the 11th of August and died on the same day. The Swakopmund cases, 1 is a 49-year-old male who presented to a private health facility on the 27th of July with symptoms consistent with COVID-19. The patient is also known to have multiple comorbidities. He was admitted on the 27th of July in a critical condition and transferred to a private health facility in Commerce region. The patient died on the 12th of August. The Swakop the second Swakop case is a 62-year-old male who presented on the 6th of August with symptoms consistent with COVID-19. He was tested on presentation and admitted to a private health facility. He is known to have multiple medical comorbidities. Since admission, the patient was in severe state and died on the 12th of August. The Windhoek case is a 66-year-old male known with a comorbidity condition. He presented with symptoms consistent with COVID-19 and was admitted on the 9th of August to a local hospital in Windhoek. He was tested on the same day. His clinical condition deteriorated and he died on the 10th of August 2020. All the results were confirmed to be COVID-19 positive. We once again express our profound condolences to the bereaved families. In summary, so far we have a cumulative number of cases totaling 3,544. And today we have announced 138 new ones. The total recovery now stands at 848. Active cases is 2,669. The death toll now stands at 27. The total sample tested is 37,797. And active contacts is 4,167. The cumulative number of people who have been in our quarantine facility now stands at 7,495, of whom 5,851 has been discharged. The number of people in quarantine stands at 1,644. In conclusion, I would like to urge the Namibians to comply with regulation and to resist the temptation to run away from the restricted area. This will be contrary to our efforts to mitigate the pandemic in Namibia. I thank you.